Features of metabolic syndrome: A. Central obesity, B. Hypertriglyceridemia, C. Insulin resistance, D. All of the above. Correct answer D. All of the above. Metabolic syndrome is also known as Raven syndrome and syndrome X. Hypertension and low HDL are the other associations. There is another syndrome X, which is angina with normal epicardial coronaries. Epstein's anomaly is seen with A. Aortic valve, B. Mitral valve, C. Tricuspid valve, D. Pulmonary valve. Correct answer C. Tricuspid valve. Epstein's anomaly is the distal displacement of the septal and posterior leaflets of the tricuspid valve. The anterior leaflet is normally attached and is hence much larger than the other leaflets. Closure of the large anterior leaflet produces the loud tricuspid component of first heart sound in Epstein's anomaly, known as Sale sound. First drug to be given to a person with suspected acute coronary syndrome: A. Heparin, B. Tirofiban, C. Aspirin, D. Streptokinase. Correct answer C. Aspirin. Aspirin is the first drug to be given to a person with suspected acute coronary syndrome in the emergency department. First dose should be chewed to facilitate buccal absorption and early onset of action. Wrong statement about natriuretic peptides. A. Secreted by ventricular myocytes in response to stretch. B. Anti-proBNP has a shorter half-life. C. Anti-proBNP levels reflect the mean values of left ventricular filling pressures over the previous 12 hours. D. BNP has vasodilative, diuretic and natriuretic activity. Correct answer B. Anti-proBNP has a shorter half-life. Brain natriuretic peptide is secreted by ventricular myocardium in response to stretching of cardiomyocytes. BNP has vasodilative, diuretic and natriuretic activity and is a sensitive marker of left ventricular end-diastolic pressure. ProBNP is the precursor of BNP, which is enzymatically cleaved into an inactive amino-terminal fragment known as anti-proBNP and a biologically active carboxyl terminal fragment called BNP. Anti-proBNP has a longer half-life, 1 to 2 hours, versus 22 minutes compared to BNP. Hence, levels of anti-proBNP are more stable and less influenced by acute hemodynamic variations than BNP levels. For this reason, anti-proBNP levels reflect the mean values of left ventricular filling pressures over the previous 12 hours. All of the following are true about PCSK9 except A. Secreted into plasma by kidney, B. Binds LDL receptor at the surface of liver cells, C. Prevents recycling of LDL receptors, D. Results in reduced LDL cholesterol clearance. Correct answer A. Secreted into plasma by kidney. PCSK9 is secreted into plasma by liver and not the kidney. Binding of PCSK9 to LDL receptors on hepatocytes enhances degradation of the LDL receptors by endosomes. This in turn leads to reduced LDL clearance. Inhibition of PCSK9 with monoclonal antibodies reduce atherosclerosis and cardiovascular events. Which of the following is an antidote for dabigatran? A. Abciximab, B. Idarucizumab, C. Infliximab, D. None of the above. Correct answer B. Idarucizumab. Abciximab is a glycoprotein 2b3 antagonist and infliximab is a TNF-alpha antagonist used in the treatment of autoimmune disorders. Best option for prosthetic valve thrombosis presenting with stroke: A. Thrombolysis, B. Intravenous heparin, C. Subcutaneous heparin, D. Surgery. Correct answer D. Surgery. In patients presenting with stroke, surgery is the first option as thrombolysis is contraindicated. Surgical treatment has a combined risk of death or stroke of 9%. For prosthetic valve thrombosis without stroke, if the thrombus in the prosthetic valve is less than 5 mm in size, only intravenous heparin is recommended. For larger thrombi, there are two options: thrombolysis versus surgical treatment. Thrombolysis has an initial success rate of 70 to 80%, but there is a 5 to 22% risk of embolism and 5 to 12% risk of disabling stroke. Thrombolysis is the preferred treatment for right-sided prostatic valve thrombosis and small left-sided thrombi. Which of the following is not a feature of hyperkalemia on ECG? A. Prolonged QT interval. B. Tall peak T waves. C. Sine wave pattern. D. Atrial paralysis. Correct answer A. Prolonged QT interval. Prolonged QT interval does not occur in hyperkalemia. It is a feature of hypokalemia. Tall peak T waves, widening of QRS with merging of QRS with the beginning of the T wave, sine wave pattern, and atrial paralysis with sinoventricular conduction are features of hyperkalemia. Location of atherosclerotic plaques in relation to myocardial bridge. A. 20 to 30 mm proximal to the myocardial bridge. B. Within the myocardial bridge. C. Distal to the myocardial bridge. D. None of the above. Correct answer A. 20 to 30 mm proximal to the myocardial bridge. Reversal of systolic flow from the bridge segment has been noted on Doppler tracing. In the coronary segment proximal to the bridge, the retrograde flow collides with the antegrade flow, causing high systolic wall shear stress. This is thought to be the reason for coronary plaques about 20 to 30 mm upstream of the myocardial bridge. Risk factors for upper limb venous thrombosis. A. Vigorous arm exercise. B. Central venous catheter. C. Pacemaker or defibrillator leads. D. All of the above. Correct answer D. All of the above. Paget-Shorter syndrome is the spontaneous thrombosis of the deep veins of the upper limb, axillary or subclavian vein, after vigorous arm exercise. Sudden jerky movements cause the axillary vein to be crushed between the clavicle and the first rib. This can damage the intima of the vein and initiate thrombosis. Implanted central venous catheters in place for a long time can initiate upper limb venous thrombosis. In case of pacemaker and defibrillator leads, the more the number of leads, higher the risk of thrombosis. Risk of intracranial bleed for tenecteplase in acute pulmonary embolism. A. 2%, B. 5%, C. 10%, D. 15%. Correct answer A. 2%. The incidence of hemorrhagic stroke after thrombolysis of acute pulmonary embolism with tenecteplase was 2%, while it was only 0.2% in those given heparin alone. But there was a significant reduction in all-cause mortality or hemodynamic collapse in the tenecteplase group. Hence, tenecteplase can be considered in all with hypotension and as rescue treatment in those with evidence of right ventricular dysfunction and myocardial injury. Surgical embolectomy in pulmonary embolism is indicated in A. Impending paradoxical systemic embolism, B. Hypotension with contraindication for thrombolysis, C. Failed thrombolysis, D. All of the above. Correct answer D. All of the above. By impending paradoxical systemic embolism, it is meant that a thrombus in transit has been caught in the patent foramen ovale and is extending into both atria. True regarding inferior vena cava filter for prevention of pulmonary embolism. A. Indicated when anticoagulation is contraindicated. B. Recurrence in spite of anticoagulation. C. Increases risk of leg vein thrombosis. D. All of the above. Correct answer D. All of the above. In addition to these, a retrievable filter should be used whenever there is only a transient risk factor. Retrieval should be attempted after reversal of the predisposing risk factor. 100 points on the pulmonary embolism severity index would be classified as A. Class 1, B. Class 2, C. Class 3, D. Class 4. Correct answer C. Class 3. Class 3 has a 3.1% 30-day mortality risk and has points in the range of 86 to 105 points. Class 1 with less than 65 points has virtually no 30-day mortality risk, while class 5 with over 125 points has 24.4% 30-day mortality risk. Parameters considered for risk stratification are age, male gender, history of cancer, history of heart failure, history of chronic lung disease, pulse rate above 110 per minute, systolic blood pressure below 100 millimeters of mercury, respiratory rate of 30 or more, body temperature below 36 degrees centigrade, altered mental status, and arterial oxyhemoglobin saturation below 90%. Parameters have different weightages with maximum of 60 for altered mental status and 30 each for history of cancer and hypertension. Tachypnea and hypothermia each have 20 points, while age gets 1 point per year, so that above 60 years age gets the highest weightage. The rest of the parameters get 10 points each. Advantages of low molecular weight heparin over unfractionated heparin includes all of the following except A. Nearly complete absorption after subcutaneous administration, B. More predictable dose-effect relationship, C. More platelet activation, D. Lower risk of heparin-induced thrombocytopenia syndrome. Correct answer C. More platelet activation. Low molecular weight heparin produces less of platelet activation than UFH. Though the risk of heparin-induced thrombocytopenia syndrome is lower with LMWH, it cannot be substituted for UFH once HIT has occurred, as the HIT antibodies cross-react with LMWH. If anticoagulation is needed in HIT, bivalirudin can be used. Wrong statement about nitrates. A. Predominantly venodilator. B. Have coronary vasodilator effects. C. Contraindicated in vasospastic angina. D. Should be avoided in hypotensive patients. Correct answer C. Contraindicated in vasospastic angina. Nitrates are useful in vasospastic angina. Non-selective beta blockers like propranolol are avoided in vasospastic angina as they can cause alpha overactivity. Nitrates are contraindicated in those on phosphodiesterase 5 inhibitor sildenafil. Beta blockers reduce myocardial oxygen consumption by A. Reducing heart rate, B. Reducing blood pressure, C. Reducing myocardial contractility, D. All of the above. Correct answer D. All of the above. The anti-anginal effect of beta blockers are by all these mechanisms. They are most useful in angina of increased demand as in effort angina. Threshold for transfusion in anemia with acute coronary syndrome and no hemodynamic compromise. A. Less than 10 gram per deciliter, B. Less than 9 gram per deciliter, C. Less than 8 gram per deciliter, D. Less than 5 gram per deciliter. Correct answer C. Less than 8 gram per deciliter. Hemoglobin less than 8 gram per deciliter is the usual threshold for transfusion in acute coronary syndrome without hemodynamic compromise. Cause of anemia should be investigated and iron supplements can be given, but erythropoietin should be avoided because of potential thrombotic risk. Interventions with a high risk of bleeding are better avoided in those with severe anemia. Disadvantages of perioperative heparin bridging. A. Risk of thromboembolism due to subtherapeutic dose. B. More prolonged total hospital stays. C. Cost and inconvenience of heparin therapy. D. All of the above. Correct answer D. All of the above. In addition to this, there can be excessive bleeding during reinitiation of warfarin with heparin overlap. Hence, continuing warfarin through the procedure is becoming standard of care in certain special instances. This is more applicable to procedures with relatively low bleeding risk and in those with high risk of thromboembolism. Cataract surgery under topical anesthesia is one such potential situation in which the bleeding risk is very low. Ablation of atrial fibrillation is a situation in which the thrombotic risk is high. Which of the following should not be combined with statin? A. Fenofibrate, B. Ezetimibe, C. Gemfibrozil, D. Aspirin. Correct answer C. Gemfibrozil. If gemfibrozil is combined with statin, there is increased risk of muscle symptoms and rhabdomyolysis. In valvular pulmonary stenosis, A. Main pulmonary artery alone is dilated. B. Main pulmonary artery and left pulmonary artery are dilated. C. Main pulmonary artery and right pulmonary artery are dilated. D. Main pulmonary artery, right pulmonary artery and left pulmonary artery are dilated. Correct answer B. Main pulmonary artery and left pulmonary artery are dilated. In valvular pulmonary stenosis, the main pulmonary artery is dilated due to the eddy currents produced by the high velocity jet of pulmonary stenosis. As the left pulmonary artery is in the same direction as the jet, it is also dilated. The right pulmonary artery is not dilated as the direction of the artery is almost perpendicular to that of the high velocity jet. Main pulmonary artery and both pulmonary arteries are dilated in pulmonary hypertension. Conditions which predispose to statin adverse effects. A. Impaired renal or hepatic function. B. History of previous statin intolerance or muscle disorders. C. Unexplained elevation of SGPT. D. All of the above. Correct answer D. All of the above. In addition to these, age above 75 years, Asian ancestry, and previous hemorrhagic stroke are potential conditions to be considered while considering high-intensity statin therapy with regard to predisposition for adverse effects. Concomitant usage of drugs likely to affect statin metabolism should also be considered. Effect of sacubitril/valsartan on natriuretic peptides is A. Decrease in BNP and NT-proBNP. B. Increase in BNP and NT-proBNP. C. Increase in BNP and decrease in NT-proBNP. D. Decrease in BNP and increase in NT-proBNP. Correct answer C. Increase in BNP and decrease in NT-proBNP. Both BNP and NT-proBNP are natriuretic peptides which are increased in heart failure. Angiotensin receptor neprilysin inhibitor sacubitril/valsartan improves heart failure and thereby decreases NT-proBNP levels. But by way of neprilysin inhibition, degradation of BNP is reduced and BNP level tends to rise. Which of the following is not a cause of elevated LDL cholesterol? A. Pregnancy. B. Hyperthyroidism. C. Uncontrolled diabetes mellitus. D. Obesity. Correct answer B. Hyperthyroidism. Hypothyroidism is associated with elevated LDL cholesterol and triglycerides. Cholesterol and triglycerides rise progressively throughout pregnancy. It may be noted that treatment with statins, niacin, and ezetimibe are contraindicated in pregnancy and lactation. Triglycerides are elevated in poorly controlled diabetes mellitus. Both triglycerides and cholesterol are elevated in obesity. Which of the following is not meant for closure of patent ductus arteriosus in a newborn baby? A. Paracetamol. B. Prostaglandin E1. C. Ibuprofen. D. Indomethacin. Correct answer B. Prostaglandin E1. Prostaglandin E1 is used for maintaining ductal patency in ductus-dependent circulations. Both oral and intravenous paracetamol have been used for pharmacological closure of patent ductus arteriosus in newborn. Indomethacin was the earlier drug being used for pharmacological ductal closure, but seldom used now because of its adverse effect. Then came ibuprofen, which is still being used. Paracetamol is the latest addition with a better side effect profile than ibuprofen. Here are the relevant references. Which of the following is not used for provocative testing for Brugada syndrome? A. Ajmelin. B. Isoprenaline. C. Flecainide. D. Procainamide. Correct answer B. Isoprenaline. ST elevation in Brugada syndrome is quite variable and may need drug challenge for unmasking. Isoprenaline is not used for provocative testing in Brugada syndrome though it is often used in other conditions for induction of arrhythmia in the electrophysiology lab. In fact, isoprene is sometimes used to suppress arrhythmia in Brugada syndrome. All of the following are features of Timothy syndrome except A. CACNA1C mutation, B. Named after Catherine W. Timothy, C. Phase 1 of action potential is affected by gene mutation, D. Multi-system disorder. Correct answer C. Phase 1 of action potential is affected by gene mutation. Cav 1.2 calcium channel is affected by CACNA1C mutation in Timothy syndrome. This channel is important in the phase 2 plateau phase of cardiac action potential. Timothy syndrome is characterized by marked prolongation of QT interval, syndactyly, congenital heart disease, cognitive abnormalities, and intermittent hypoglycemia. It is designated as LQT8. Wrong statement about prasugrel. A. Not influenced by CYP inhibitors. B. Higher bleeding risk in those with previous cerebrovascular events. C. Use in acute coronary syndrome is better restricted to the cath lab. D. Recommended in those above 75 years. Correct answer D. Recommended in those above 75 years. Prasugrel has a higher bleeding risk in those above 75 years and in those with body weight less than 60 kg. Prasugrel is not interfered with by CYP inhibitors, CYP2C19 gene variants, or proton pump inhibitors, unlike clopidogrel. Rapid onset of action enables its use in the cath lab after coronary angiography if percutaneous coronary intervention is the option. This avoids the bleeding risk after an initial loading dose, which could be significant in case the option after angio is for early coronary artery bypass grafting. Prasugrel is better in diabetic patients and in moderate to high risk non-ST elevation acute coronary syndromes. Which of the following is a marker of myocardial stretch? A. BNP, B. Troponin, C. Myoglobin, D. Galactin-3. Correct answer A. BNP. BNP and NT-proBNP are markers of myocardial stretch which can be markedly increased in heart failure. They can also be used to differentiate between constrictive pericarditis and restrictive cardiomyopathy, as there is no myocardial stretch in constrictive pericarditis. Troponin is a marker of myocardial necrosis, and so is myoglobin, though the former is highly specific while the latter is non-specific. Galactin-3 is a new biomarker protein, a member of the lectin family. It is associated with activation of macrophages and fibroblasts. This results in secretion of procollagen 1, which is cross-linked to form collagen. Hence, galactin-3 can be considered as a marker of cardiac fibrosis. Reversed mismatch on positron emission tomography scan is seen in A. Left bundle branch block, B. Right ventricular pacing, C. Non-ischemic cardiomyopathy, D. All of the above. Correct answer 4. All of the above. Reversed mismatch means normal perfusion with reduced uptake of 18-fluorodeoxyglucose. In addition to the above conditions, this situation can also be seen in the setting of revascularization early after myocardial infarction and sometimes in diabetes mellitus. Usual perfusion metabolism mismatch is reduced myocardial perfusion and contractile function with relatively preserved or increased FDG uptake. It may be noted that ischemic myocardium switches over to glucose utilization instead of the usual fatty acid metabolism, as glucose metabolism gives more ATP per oxygen molecule used. Tracers used to assess perfusion during PET scan include rubidium-82 and N13 ammonia. Tracer used to assess cardiac sympathetic denervation. A. 11C metahydroxyephedrine, B. Technetium 99M sestamib, C. Fluorodeoxyglucose, D. None of the above. Correct answer C. 11C metahydroxyephedrine. Myocardial sympathetic denervation assessed by 11C metahydroxyephedrine has been shown to be predictive of sudden cardiac death. AV block in the presence of features of dilated cardiomyopathy may indicate A. Sarcoidosis, B. Lyme disease, C. Myotonic dystrophy, D. All of the above. Correct answer D. All of the above. Other conditions associated with this combination are laminase mutation and giant cell myocarditis. Pick the wrong statement. A. Light chain cardiac amyloidosis has a better survival than transthyretin cardiac amyloidosis. B. Light chain cardiac amyloidosis responds to chemotherapy. C. Transthyretin cardiac amyloidosis is associated with sensory motor polyneuropathy. D. Transthyretin cardiac amyloidosis can be detected by bone scintigraphy. Correct answer A. Light chain cardiac amyloidosis has a better survival than transthyretin cardiac amyloidosis. Light chain cardiac amyloidosis with left ventricular systolic failure has a median survival of 4 months, while transthyretin amyloidosis has a median survival of 3 to 6 years. Patients with less than 20% light chain amyloidosis load who respond to chemotherapy has been shown to have a better survival than those who do not respond. Light chain amyloidosis involves almost all organs, with predominant involvement being in the heart and kidneys. Transthyretin, the precursor protein in senile systemic amyloidosis and familial TTR-related amyloidosis, is a tetrameric plasma transport protein synthesized in the liver. TTR-derived fibrils show avidity for bone tracers, especially 99M technetium DPD. Prevalence of hypertrophic cardiomyopathy in humans: A. 1 in 50, B. 1 in 500, C. 1 in 1000, D. 1 in 1500. Correct answer B. 1 in 500. Hypertrophic cardiomyopathy is an autosomal dominant disorder with prevalence of 1 in 500 in human beings. Recommended test for monitoring the effect of bivalirudin during cardiopulmonary bypass: A. Activated clotting time, B. Eccarine clotting time, C. Prothrombin time, D. Activated partial thromboplastin time. Correct answer B. Eccarine clotting time.